Good day. This is Dr. Sanjeev Singh Yadav. I am basically a surgeon, but as a routine, I now practice proctology. And proctology means treatment of anal canal diseases like the common ones are piles, fissure, fistula, abscess or pus formation in that area, along with pilonidal sinus. These are the common things which we started as a daycare procedure because the concentration on anal canal diseases was not that much, as every hospital was dealing more with gastrointestinal diseases like liver disease, intestines, stomach, pancreas, gallbladder, and appendix and other things. The concentration was not there on anal canal care, and there are a lot of quacks in and around the whole country where they are tying some threads and using some acid or some material to treat the anal canal conditions, which is becoming painful and not successive. Basically, the three major things which come into anal canal are the piles, which we normally call as hemorrhoids in technical term. Bawasir is one term which is used very commonly in the Urdu speaking areas. Molalu is something which is called in Telugu, and these are the conditions which create more problems to people in day-to-day life. We will talk of piles first. Piles are basically three in number in the anal canal. If you take the anal canal as a clock, they will be there at 3 o'clock, 7 o'clock and 11 o'clock. This is because the anal canal blood vessel distribution is like that. Right from the rectum, which is the last part of the intestine, you will have the anal canal which is around 1.5 inch in length. It is basically a fixed structure, and in that you have lot of muscles like longitudinal circular muscles to help in removing the fecal matter. Similarly, at the portion where the rectum joins the anal canal, you have three cushions at 3 o'clock, 7 o'clock and 11 o'clock, which are something like tonsils, and these cushions help in removing the content of the fecal matter like extra water which is needed to the body, minerals, vitamins, salts and other things, when the rectum basically, which is more of a storage organ for the fecal matter which comes from the intestine above. So that role of this anal cushions, if it gets disturbed, if it gets manipulated, if it gets infected, then slowly because of the internal anal pressure, the pile masses slowly come down 3 in number. 3 o'clock, 7 and 11. Slowly they come, they don't come that faster. These are basically called as internal hemorrhoids because there is nothing like external hemorrhoids, these are internal hemorrhoids. The hemorrhoids are nothing but a bunch of anal cushions in which there are lot of small vessels like arteries and venules which join together and send back the ones which I told, that absorption of water and minerals to the upper part of the body through the vascular. Once they get infected, they become bunch of vessels, they slowly sag down with a skin cover on it, that is the anal mucosa. Once they become more bigger, then they start to bleed. In these we have 4 conditions like grade 1, 2, 3 and 4. Grade 1 is just starting of the sagging, where it is difficult for the patient to find out unless a endoscopy is done. The only condition they can know is some soiling or itching around the anal area and the underpants getting wet. The second condition or second degree is when the pile masses started to sag down, and sometimes they can also bleed. After the motion is over, it is basically a painless bleed. The third condition is the pile mass almost come to the edge of the anal canal. They may need pushing up or reduction to go into the anal canal after the motion is done. They will touch your fingers when you clean your toilet, like we do ablution. Even if you are putting a toilet paper, they definitely touch and they bleed. Till now, all this is painless bleeding. Now the fourth grade is the whole pile mass coming out of the anal canal. It is something like this and being like this, and the whole area becomes swollen because the blood supply is on the top. As the anal sphincter closes on itself, the hemorrhoidal masses don't get proper blood supply, so the venous system is activated and there is a swelling or edema as what we call as, that is grade 4. In grade 4, pain might start, bleeding might be a regular feature from 2, 3, 4, and the swelling increases in nature, the patient needs urgent treatment. So these are the 4 grades of hemorrhoids. They can be a combination of grade 2 and grade 3, grade 3 and grade 4 in the later part of the hemorrhoidal thing. Now the issue with this thing is, once these 3 masses are coming down like this, the space inside the anal canal reduces. That is why the patient needs to go to the toilet at least 3 to 4 times. He will have a feeling that something is still there. Something is still there. That is the hemorrhoidal masses. But the fecal matter also remains. So he needs to go 3-4 times, and every time he goes there is a bleeding. It will be a very silent bleed, the pain will not be there. That is why the people will do one thing, they will not consult the doctor, they will try to take some medication. Once they start to feel some touch, they will feel there is some disease in them, but they will only come when the pain starts. That is a grade 4 condition. Or maybe one of the pile mass is grade 4, the other 2 are grade 3. That is why the pain starts, and that is why the patient comes to a doctor. Stopping bleeding is more important because a slow, silent bleed can reduce the hemoglobin percentage of the body, leading to other complications in the heart, lungs, liver, kidney, and the patient might go into a state of shock also. I have seen patients coming with HB 3 grams, 5 grams, 7 grams, 8 grams, in which we have to give blood to them in a slowly phased manner, because this blood is not continuous flow, it is occasional, and whenever the blood is there, the retraction of the vessels happen. God has given us some healing capacity. Some days the blood will stop, then once again it starts. That is why the patient gets acclimatized to that type of surrounding, and he will feel lot of dyspnea while he is walking, restlessness, body pains, not able to concentrate on his work. All these situations might come, which can lead to presence like this and create a bigger headache to the patient. That is the reason why treatment of early hemorrhoids give a better result and the patient becomes well. Grade 4 ultimately patient will definitely come because he is having problem. Now after all these things, after the problem of multiple defecations start, patient will consult a doctor. What we do here is we do a video endoscope after taking into consideration whether the patient is having diabetes, hypothyroidism, because in these conditions the intestinal motility gets reduced. That is the reason why the patients may present very late, but all said and done he might get more constipated, and this is the reason why he will come very late. We do a video scope and show to the patient on the TV, what type of disease he is having. Earlier a proctoscope used to be done where the doctor himself used to see. Now the video cam scope will show the patient the disease per se, and the patient will be rest assured that this is his present condition, and after treatment the condition will definitely improve, which will be shown to him after the surgery or the medical treatment is over. Right? Now the treatment part of hemorrhoids. Before that, why it comes? There are multiple factors why the hemorrhoid comes. The most common factor is familial. It could be genetic in nature, it could be familial. That is the reason why the patient will get hemorrhoids. He might say that, sir, I don't eat non-veg, I don't eat spicy food. So in those cases we have to consider whether it is a familial condition where it is coming through families, through ages. Number 2, constipation. Constipation is basically more of dietary, water intake, not having lot of fiber food, having lot of non-vegetarian food which doesn't get digested, having lot of junk food like cheese, burger, pizza, bread and all those things which is normally not suited to the Indian body. Right? These may cause constipation. Pregnancy induced constipation will come because of hormonal action, because of the weight of the uterus sitting on the rectum and not allowing the motion to pass freely, and patient will tend to avoid going to the toilet, especially ladies, because they have lot of work to do in the morning. They will try to postpone the toiletry activity, which may lead to constipation like things. So these are the common things. Other things which are there high up in the intestine like irritable bowel syndrome, pseudomembranous colitis, IBS, and other diseases like tuberculosis infection and chronic infection of the intestines might lead to constipation and diarrhea, and hemorrhoids can develop, and more so when the patient is having a malignancy in the intestinal area. So these things can come. As I just forgot to mention, Crohn's disease is one other condition where there will be multiple problems in the intestine where the normal rugosity of the intestine is lost, that could be leading to watery diarrhea and hard stool. So these are the conditions why you get hemorrhoids. Obesity is one major factor nowadays. Sedentary lifestyle, not eating good food, not doing exercise, eating a lot of junk food and watching TV for a longer duration can cause obesity, which also runs in families. This could be one of the major reasons why you definitely can get hemorrhoidal disease. Now the treatment part. Earlier the treatment used to be tying the hemorrhoidal masses which are hanging, but not doing anything to the hemorrhoidal vessel which is above on the anal canal. That is the reason why recurrence is very common. This tying was done at the area where the anal canal is there, where there is a sphincter or door which could get damaged and could become tightening of the sphincter leading to fissure formation, or the total cutting of the sphincter leading to lack of control. These are the earlier surgeries. What happens when you tie thread? There will be inflammatory reaction and the whole door will become very short. Fissure, a common possibility, can occur because of this. You can get infection and get fistula or pus formation in that area. Nowadays, with advent of modern mechanics, we do Doppler guided hemorrhoid artery, hemorrhoid vessel ligation, that is closure of the blood supply of the hemorrhoidal plexus, and either you do laser to that area so that the hemorrhoidal blood vessels shrink, or you can do rectopexy or anopexy so that the pile masses are tied in such a way that they are done inside the anal canal and nothing is done at the level of the anal opening, which might not cause any problem to any patient except for mild pain, which is more than what is done in laser. So lasers are really helpful in treating the disease. They are a daycare procedure, and definitely this has made a major change in the treatment of hemorrhoidal disease, and patients are really happy because they don't need to stay in the hospital, no need of major cutting, no need of any dressing, and no need of having more pain. So early back to work is something which is very needed to the patient, and they are really happy with this type of procedures. This is regarding hemorrhoids, piles, bawasir or mulalu.